Okay, here I am in Hanover. I've been a bit nervous, I'll be honest. I've just had my hip replaced by Kristian Kley, one of my dearest and closest friends. And he said that it didn't need doing because there was nothing wrong with me. No. So Kristian, how bad was my hip?
Well, it was basically half of the cartilage of it, of the part where all the weight lies on, was gone. And 1/3 of the superior part of it was like completely scratched off, looked like condensed marble.
Why was I getting that catching, do you think?
Well, parts of the cartilage that resolved from the head just swam around everywhere in the joint.
So
we
lots of
have
bodies.
to say there were loose bodies that caused that pain, maybe a little bit of obstruction that you've had.
So you took your time with my operation. How long did you take to do my operation?
Yeah, well, we checked everything twice, of course, and so therefore it took like 27 minutes, I guess.
Okay.
Yeah.
I'm glad you took your time. So we did the surgery at 7 o'clock.
Yeah, well, it was 7:25.
Yeah.
Knife to skin was 7:25. We were done a little later, so now that was like 2 hours ago.
So I'm delighted to say it's not hurting. I can wiggle my toes. And I've come here to Hanover. Really, if I timed it a few months in the future, I could have had it done in the UK because Kristian's joined the group. But I came here because Kristian did an anterior approach to my hip, which is what I wanted. And you work with the guy that developed that technique. What was he named?
Well, basically, the developer of this technique was Röttinger. But Röttinger and his fellow Huber, working still in Munich, worked together, and Röttinger gave it all over to Huber, and so this is where I learned that. Yeah.
And it's an approach at the front of the hip.
Yeah, well, basically it's the intermuscular plane where you go in. Is in between TFL and gluteus medius.
So you don't cut any muscles. You just
nothing.
And so what's your you've done quite a few hundred of these now.
Of course.
And
200 a year.
200 a year. And what's your dislocation rate so far?
Well, zero. There ain't no dislocation so far, so let's hope you're not the first one.
And
knock on wood. So there is no dislocation rate due to the fact that you don't touch any muscle, I guess. So you don't resect anything that holds the hip together. At the end, during the surgery, of course, we can dislocate because you're relaxed in a state of relaxation. But right now, as the muscle pulls it together, it's really tough to get it dislocated. There is no infection rate in my hands, so 0%, zero, no infection after 1,000 of those. I guess the reason, well, there is plenty of reasons for that, but I guess the biggest reason is that we are very anatomic, so we don't cause massive bleeding, secondary hematomas that might secondarily infect.
And it's quick surgery.
And it's quick surgery, right. Whenever you remain under the margin of 20 minutes or 30 minutes, there is almost no time for the bacteria that are in the surgical field anyway to cause harm.
So Andy Murray is like me. He's a great sportsman, and he's done his Netflix video, Resurfaced. Why didn't we go for resurfacing with me?
Well, the resurfacing has pros and cons. Obviously, it sounds initially good to resurface, spare some bone at the femur to be in charge to replace the hip later on at people young at age when they undergo their primaries.
I'm very young for this surgery.
Of course you are. So, but anyhow, I mean, what you spear at the femur, you have to sacrifice at the acetabular side.
On the cup side, yeah.
And to be in charge to resurface the head, which is usually way bigger than the artificial head if you go for primaries and a resurfacing, you cannot construct this as a head inlay acetabular cup design. So you